pain pathway generally consists of 4 major steps. First, we start with transduction, where the pain information travels from the peripheral nervous system to the central nervous system. Then we have transmission, where pain information travels from the central nervous system, here in the spinal cord, up into the thalamus and the higher cortical centers. Thirdly, we also have modulation, this descending modulation where the central nervous system is limiting the flow of pain information. And then we finally have perception, which is the human experience of pain being the sum total of these physiological processes and then also the psychological factors of higher thought and emotion. So considering that psychosocial component of chronic pain. Now we can get a little bit more involved and into the weeds. There are dorsal column lemniscus and anterolateral pain pathways, a bunch of different nerve pathways that you do not need to know for part 2 of the board exam. They are tested on part 1, so if I eventually start making part 1 videos, we can definitely cover those pathways in that kind of video. But for part 2, this is all you need to know for the pain pathway. So we're going to talk about 4 major categories of pain, and they all fit in the continuum of axis 1 and axis 2 factors. So the first category is somatic pain. And so somatic pain is where you have an increased stimulus yielding an increased pain. So this is what you typically would view as our day-to-day dental patient in pain. So we have musculoskeletal pain, which involves the TMJ, which will have a whole video on temporomandibular disorders in the next video, a periodontal pain, muscular pain, which is also called myofascial pain. We also have visceral pain, and this involves the salivary glands and the pulp, the nerves of each individual tooth. So these are the 2 main subcategories of somatic pain. And visceral pain we talked about in our very first endo video. We talked about dentinal and pulpitis pain and how you have activation of A delta and C fibers respectively to the spinal cord or the brainstem. So if you haven't already checked out my endodontic series on pain, to learn more about A delta and C fibers, go check that out. So our second category of pain is the neuropathic pain. And this will be the most important category in terms of this video. And we'll dive into different examples of neuropathic pain. So whereas somatic pain was dependent on the magnitude of the stimulus talked about before, and some examples of this are trigeminal neuralgia, stroke, and trauma.